Good evening, I'm Esther Githui Ewart in for Vincent McCory. This is Africa 54. We begin this evening with a scornful speech given by Zimbabwean President Robert Mugabe at the United Nations General Assembly. The 93-year-old leader pulled no punches, calling U.S. President Donald Trump a giant gold Goliath. Mugabe said his country has defeated the monster called imperialism in the past, and that they are ready to defeat another monster by whatever name.
May I say to the United States President, Mr. Trump, please blow your trumpet. Blow your trumpet in a musical way towards the values of unity, peace, cooperation, togetherness, dialogue, which we have always stood for and which are well written in our very sacred document, the Charter of the United Nations.
Now, in a landmark deal, HIV patients in Africa will now have access to the latest drugs for $75 a year. The arrangement is a major victory for the poorest nations fighting AIDS, a health epidemic with unrestrained global reach. Here's VOA's Tina Trin.
In the fight to end the AIDS epidemic, a major victory achieved. Cutting-edge drugs available for the first time to patients in Africa at a mere $75 a year. The announcement was made Thursday during the United Nations General Assembly.
What we are talking about today with this life-changing announcement is about the quality of medicine, but is about equity, is about dignity, is about access to medicine as a human right.
A deal between the Bill and Melinda Gates Foundation and Indian drug makers Mylan Laboratories and Aurobindo Pharma will bring relief to the poorest of those afflicted with HIV, of which there are 36.7 million globally.
The spiraling cost of healthcare provision in every country in the world needs to be addressed, and we can only address this in ways that increase equity in access to services based on need and not on ability to pay.
Dolutegravir, or DTG, is a key component of the combination drug that was until recently limited to richer countries.
It's more effective, it has fewer side effects, it's less prone to resistance, and now, thanks to this landmark price deal, it's cheaper.
According to Reuters, the $75 annual cost is less than the price for 1 day's supply of DTG in the U.S.
We estimate that over the next 6 years, South Africa will potentially save up to $900 million US. This is a huge saving.
The reduced cost of DTG will ultimately mean wider and faster access for populations across the globe.
It took us more than 10 years to transit the efavirenz, the current treatment, from the rich countries to the downstream, to the field. And now we are bringing DTG in less than 3 years, which is a record time.
For the world's neediest HIV and AIDS patients, the time couldn't come soon enough. Tina Trin, VOA News, New York.
Now, for more news on the UNGA, joining us from UN headquarters in New York is VOA's Margaret Besheer. Margaret, it has been an eventful week there that included talks on refugees fleeing Myanmar. What more can you tell us?
Yeah, the issue of the Rohingya Muslims leaving Myanmar has been a very urgent issue that leaders have been addressing here in their speeches this week. The United Nations said today that since August 25th, so basically 1 month, 429,000 people have fled from Myanmar, which also is known as Burma, into Bangladesh, which is the neighboring country. And tomorrow, the UN refugee chief, Filippo Grandi, will be going to Bangladesh to see the situation of these people, because the government there is rushing to help them, but at the same time, they're coming so quickly that many of them are living in very poor conditions. The UN also said today that this is the largest mass movement of refugees in decades. And the British publication The Economist did a survey of refugee data that they published, and it says that they compared the data with the Rwandan genocide in 1994, and they're saying the Rohingyas are fleeing Myanmar faster today than even the Hutus did in 1994. So it's a really big crisis. The Prime Minister of Bangladesh spoke last night here at the General Assembly. Her name is Sheikh Hasina, and she made some demands to the international community. She said that they need to end the violence immediately. The UN needs to send a fact-finding mission to Myanmar to find out exactly what's going on there, and they need to create safe zones in Myanmar for the civilians so that they can stay in their own country. So now, because of other crises with the Rohingyas in the past, Bangladesh is looking at something about 700,000 Rohingya refugees in their country. So it's a crisis the UN is trying to prevent from escalating. UN Secretary General Antonio Guterres has said it is equal to ethnic cleansing. So the alarm bells are up here, and world leaders are very concerned about it.
A very painful story there, Margaret. What about the African leaders expected to speak later on today?
We heard from Paul Biya of Cameroon this morning. This afternoon, we're going to hear from the prime ministers of Ethiopia and Somalia, and Kenya is also expected to address the GA today, so we'll be listening to their messages.
Thank you very much, Margaret, for your fantastic reporting.
Thank you.
Margaret Besheer reporting live for us there from the United Nations. For all of your UN General Assembly news, be sure to follow Margaret on Twitter @mbesheer.